Good afternoon, everyone, and thank you all for joining us this morning. We are here this morning with Mayor Durkan, King County Executive Dow Constantine, Dr. Jeffrey Duchin from King County Public Health, and we hope to be joined shortly by Fire Chief Harold Scoggins. Those four will be our presenters this morning, but we also would like to let you know that we have Craig Kenworthy from Puget Sound Clean Air Agency, Jason Johnson, Director of Seattle Human Services Department, Anthony Wright, the Director of Facilities and Management Division at King County, and Leo Floor, all available to answer questions should you have additional specific questions for those individuals. With that, I'm going to hand it over to Mayor Durkan, who will kick us off this morning and start off our press conference.
Thank you very much, Anthony, and good morning to everyone, and thank you for being here for this virtual press conference as we address yet another new dangerous challenge facing our region for 2020. Today, we will provide an update on the city and county's preparations ahead of this projected extremely hazardous and very unhealthy air quality that will occur in the Puget Sound region today and through the weekend. This is heavily dependent on weather forecasts, so we are giving you our best case scenario. As indicated, Craig is here from the Puget Sound Clean Air Agency to answer any questions. But this morning, we are already seeing very unhealthy levels for all with conditions expected to worsen through the weekend. I'd like to take this moment and acknowledge that the 19th anniversary of the attack on the World Trade Center was today, and really express my profound condolences to all those who lost their lives and my immense gratitude for our first responders who ran towards the danger. We continue to see those kind of heroic efforts by our firefighters throughout Washington state and the western states. The simultaneous public health threats that are caused by COVID-19 pandemic and the wildfire smoke force all of us to make difficult decisions to minimize harm to our most vulnerable communities. Even during this threat of unhealthy air and wildfire smoke, we continue to be in the midst of a pandemic that threatens the health and safety of all of us. We know that indoor gathering, even with proper precautions, increases a person's likelihood of catching or spreading the virus. While the threat caused by unhealthy air is undeniable, the threat of COVID-19 is also undeniable, and it has been our region's foremost focus. I, the county executive, and Dr. Duchin have been consulting all week about the potential for unhealthy air and trying to weigh those threats against the threat of bringing people inside during a pandemic. Understanding all of these precautions, the hazardous, unhealthy air quality has become so great that we will be standing up emergency shelter for people experiencing homelessness. Our partners at Public Health have made very clear that appropriate precautions, including air filtration, are absolutely critical to ensuring that we don't inadvertently exacerbate the dangers of this pandemic. The city of Seattle has shelters to serve hundreds of individuals experiencing homelessness at Fisher Pavilion and the Exhibition Hall that are also equipped with the necessary filtration systems to be responsive to this dual crisis of smoke and a pandemic. Another location, the Rainier Beach Community Center, where I visited last year to talk about what we were doing, is equipped with the right filtration systems, but it is currently being used as a child care center. I want to emphasize that the Seattle parks, beaches, boat ramps, and playfields will be closed through Sunday. I want to say that again, because of the air quality and the hazard that it presents to all of us. All of the Seattle parks, beaches, boat ramps, and playfields will be closed through Sunday. We will not be issuing any citations, but we really please urge everybody to stay inside. In addition, we'll have other areas that will be closed and other public facilities that we will provide a press release on all those so people know. Curbside pickups at libraries will be suspended. There'll be other restrictions on activities. We will be collecting garbage, but that should not be happening in most places in Seattle through the weekend. I want to express my great gratitude to Dr. Duchin and Seattle King County Public Health, including Patty Hayes, who could not be here today. Since the beginning of this pandemic, they have been operating with the State Department of Health to keep all of us more safe and addressing a whole range of conditions that could not have been expected in ordinary times. We now again are forced to evaluate what we do as a city, a county, and a region to address the very real dangers of the air quality conditions against the very real dangers of this pandemic. I also want to thank the firefighters who are responding to these fires that are raging throughout Washington state and the West Coast states, and all the other first responders who themselves are being in jeopardy. We've seen far too many heartbreaking stories of lives lost, homes lost, in fact, entire cities lost. I also want to thank local firefighters. We've had a range of brush fires and other fires to respond to that Chief Scoggins hopefully will be able to address us on. I also want to thank our service providers and our city workers who continue to work through these very difficult conditions, in particular those who are working with our most vulnerable communities, those experiencing homelessness. I want to also thank Executive Constantine. Once again, I think he has stepped up and the county has stepped up to be just an incredible partner with the city to address our most urgent concerns. I really implore everybody who can, please stay inside this weekend. If you know people who have vulnerable health conditions but are older, please check on them. We need to have compassion for each other and to really check on each other during this difficult time. I want to now turn it over to Executive Dow Constantine.
Well, thank you, Mayor Durkan. When the pandemic hit, it quickly became clear that the response to this new virus was going to require a coordinated effort to keep people safe and healthy, and that we would not be given a playbook by our federal administration. So looking at the possibility that people, particularly in congregate settings, would be very vulnerable to infection, King County quickly created isolation, quarantine, and recovery centers at several locations around the county. And we've been able to use these to slow the spread of the virus and preserve hospital beds for those who are most acutely ill. In fact, to date, we've helped more than 1,000 people safely isolate and recover in our locations from Seattle to Shoreline, Issaquah to Kent, all around the county. And our preparation included taking an empty warehouse in Soto and turning it into a COVID-19 assessment and recovery site. We created that for use in the pandemic, and so it has already exceptional air filtration, and it has no-touch hand washing stations throughout. Because we've worked so hard together as a community to socially distance and practice good hand hygiene and wear our masks, and to isolate and quarantine when necessary, we have been able to avoid having to activate that Soto Center, but it is ready to go when needed. Well, today, with the prolonged dangerous wildfire smoke coming in, and now in greater intensity, we are responding to another community emergency. Unfortunately, we have a resource that we can temporarily activate. Our teams are working right now to open that Soto Center later this afternoon, and we will welcome up to 77 people who are currently experiencing homelessness who need a safer place to stay as the air quality worsens. We're mindful of the risks of congregate settings, as I mentioned, and as Dr. Durkan is going to explain, we are also very concerned for the very real health risks of breathing this dangerous smoke-filled air, particularly for those with respiratory conditions. Fortunately, the building is large, and it's large enough to create substantial physical distancing inside. Each person will have their own space. They'll be separated by cloth partitions. They'll have a bed and a place to store their belongings. Public health staff will be on site to monitor for COVID symptoms and will be providing COVID testing. We're tremendously grateful to the Salvation Army for once again stepping up to partner with Seattle and with King County to respond to an emergency need in our community. Our Public Health Reserve Corps will help to staff the temporary shelter, and we thank them as well for stepping forward. And of course, we thank Mayor Durkan and the City of Seattle for teaming with us once again in this effort. King County staff from our Facilities Management Division and from our Department of Community and Human Services will also support this effort, making sure we're able to offer food water, and health, and the health and safety needs of our guests are taken care of. And the leaders of both of those agencies are on the line today. During the past several months, we've shown that in an emergency, we must and we will stand together. Our response today is another example of our commitment to our community's health and safety. And now I'd like to hand it over to Dr. Jeff Duchin, our local health officer for Public Health Seattle and King County. Jeff.
Thank you, Executive Constantine and Mayor Durkan. On top of the emerging COVID-19 pandemic, we now have an air quality threat posed by wildfires, which are an increasingly hazardous consequence of climate change. Current levels of wildfire smoke are unhealthy for everyone, and they may worsen. The health risk is greatest for people with underlying health conditions, including heart and lung disease, asthma, diabetes, and for older adults, children, pregnant women, and people experiencing homelessness. Many people at higher risk for serious COVID-19 infections are also those most vulnerable to the impacts of wildfire smoke. Moving into an indoor space reduces the health risk from smoke, but indoor spaces do carry additional risk for COVID-19. And for that reason, we're using a very large space for our cleaner air shelter with air handling that was designed for use as a COVID-19 care facility. We're also implementing all the CDC recommendations for preventing COVID-19 transmission in cleaner air shelters, and will monitor the health of the occupants. This is intended to be a short-term strategy. At this time, everyone in the community should follow their healthcare provider's advice about medication and about a respiratory management plan if you have asthma or another lung disease or cardiovascular disease. And contact your healthcare provider if you have symptoms that are concerning or questions about smoke in your health. All of us, whether we have underlying health conditions or not, should take the following steps to reduce the risk from wildfire smoke at this time. Stay at home. Limit your outdoor activities, especially outdoor exercise and exertion. Close your windows and doors in the home, if possible, to keep the indoor air clean. And if you have an air conditioner, use it in recirculation mode. Make sure your home ventilation system is maintained following the manufacturer's recommendations, which include replacing the filters regularly. Use a portable air cleaner if you have one available. And remember that heat can be dangerous too. If it becomes unbearably hot, it's better to open the windows for a short period of time. With that, I'd like to conclude my comments, and if Chief Scoggins has joined us, I'll pass the podium to him.
Unfortunately, Chief Scoggins is still tied up in another meeting, so we will go back to Mayor Durkan.
Thank you very much. We'll open it to question and answer. I know Chief Scoggins regrets that he can't be here. He was going to emphasize that any fire at this point of time poses a significant risk to everybody because of not just the wildfire smoke, but because of the incredibly flammable conditions, even here west of the mountains. So he's urging people, please don't purposely set any fires outdoors for any reason. Do not discard cigarettes or matches. And know that that can be particularly dangerous during this period of time. I think, I again, just want to thank all of our partners, everyone from Puget Sound Clear Energy, Clear Air, to the county executive, to Jeff Duchin. We've been evaluating all week at what point the risk posed by the fire smoke outweighed the risk of bringing people indoors. This latest incursion of wildfire smoke has made the air very, very unhealthy, and we've seen greater levels of particulates than we had before. So we're taking this step, very grateful to King County for working with us again, and I think with that, we'll take any questions.
Thank you, Mayor. And this is a request to anyone who is asking a question today to please be quick. We have a limited amount of time, but we will allow time for follow-ups where possible. Our first question today comes from Essex Porter. Essex, the floor is yours.
Thank you, Madam Mayor. You mentioned that there will be so many outdoor public facilities that are closed over the weekend, but that there would be no citations. why not enforce the closures?
Essex, great question. We'll be enforcing in the sense that we'll continue to advise people and have posting. But during this period of time, what we really want is for people to know and understand how unhealthy the air is. And even though we believe that people watch us and hear us, many people don't know that. And so we're going to really focus our attention on educating people and urging them to stay inside.
Essex follow-up?
Yes, a follow-up for Dr. Duchin. Once it begins to clear and we begin to see blue skies again, does the effect of the smoke linger? Is it still unhealthy even though we may see blue skies in the next few days? How long will it continue to be unhealthy?
Thank you, Essex, for the question. I'd like to start and then ask Craig Kenworthy to comment as well from the Puget Sound Clean Air Agency. I do not recommend looking at the sky as an indicator of the risk. We have some very good websites, Puget Sound Clean Air Agency and Air Now, where folks can go for current air conditions that include the invisible particulate matter that is so dangerous. So that's the first thing. Don't just look out the window and think you can gauge how risky it is out there with respect to air quality. And then, Craig, would you like to comment on the forecast?
Sure. So right now we project that air quality is not likely to improve soon. We may see some slight improvements, but when I say that, that's going from extremely hazardous or unhealthy conditions to slightly less unhealthy conditions. That doesn't mean people should be going outside and engaging in activities. And the soonest we might see significant clearing looks like sometime early next week. To the point about the health effects, there is some data that indicates that health effects continue for days after an exposure at pollution levels this high, so that people might be having follow-on health effects even after the air has cleared.
Thank you very much. Our next question will come from Carolyn Bick, South Seattle Emerald, followed by Nick Popham, Como 4. Carolyn, the floor is yours.
Thank you. So I'm just curious. The city has the authority, as Erica C. Barnett points out, to open libraries and government buildings even in a pandemic. So given the pandemic and the knowledge and foresight that this wildfire season is coming, given the fact that it happens every year and climate change will only make it worse, why didn't the city start preparing shelters ahead of time to meet these distancing requirements? And why wasn't the city just in general not more prepared for this to happen, particularly in light of the pandemic?
Carolyn, I'll assume that question was to me. We actually were prepared and had been preparing on this. In fact, two of the facilities that were most prepared for this occasion are being, as I said before, are being utilized as homeless shelters. Throughout this event, we've been consulting with Seattle King County Public Health to weigh the hazard of the smoke posed to people with the hazard of bringing people indoors, because we know that the virus can be transmitted more readily indoors. And the levels we were at earlier this week, the advice was that the hazard of the virus outweighed trying to bring people inside, but the air quality has significantly degraded. And so we were prepared, and in fact, together with the county, had early on identified some of these quarantine and isolation facilities as potential places that we could bring people. Again, we really want to thank the county for all they've done, including Leo Floor. Also thank Jason Johnson, who's on the phone, because we did have plans in place. We're able to mobilize and do this rather quickly.
Carolyn, follow up?
Yes. I was also curious, since there are also several hotels in the city that have been sitting empty for the last several months, is the city looking to work out a plan to open those potentially as smoke shelters for folks experiencing homelessness, since those would also serve to meet the distancing guidelines and keep people out of these conditions?
So we're looking at all options depending on how long this will last. Those hotels would have to be leased, bulk leased by the city. And then you've got to provide the services. As the county executive indicated, Salvation Army has been, it will be manning this shelter, but every place that we open a shelter also requires there to be services. So we're looking at a range of plans, and of course would be working with City Council and others within the budget constraints that we have going forward.
Thank you, Mayor. Our next question will come from Nick Popham, Como 4, followed by Erica Barnett, C is for Crank. Nick, floor is yours.
Hi, thanks so much. So my first question is, what's your recommendation for folks who only have those cloth face coverings? And obviously those don't really help with smoke, but they can't really go out and get N95 masks because we need to save that for healthcare workers dealing with the virus. So what's your recommendation for folks who only have, say, a cloth face covering right now with the smoke coming?
Thanks. This is Jeff Duchin. I'll start and again ask Craig Tenworthy from Puget Sound Clean Air Agency to comment. But we do still have a shortage of medical grade N95 masks, which are the ones that do the best at filtering small particles, and we need to reserve those for our healthcare workers. There may be limited quantities available for first responders who need to fight fires and do other activities in the public. We recommend cloth masks at all times when in public to prevent the spread of COVID-19, and they're being shown to be increasingly effective in that context. However, they provide very limited, if any, protection against the small particles that we're concerned with in an air quality wildfire event. So people should not depend on those cloth masks to provide meaningful protection against the wildfire smoke, and should take the other steps that we recommended, avoiding exposure by staying at home, closing windows and doors, and taking the other steps to improve the quality of the air in the home. Craig, would you like to please follow up on your recommendations for respiratory protection?
Yes, so I'm going to emphasize again the staying at home and keeping your windows shut if you can. And the reason is this: a significant portion of the particulate will settle out in a home with the windows shut. If you open the windows, you will stir that up. So recognizing we cannot be handing out N95 masks during the pandemic, the best thing they can do is don't go out unless you absolutely have to, and let your windows and doors be shut and sealed, and some of it will settle out and the air quality in your home will be better than outdoors.
Thank you, Craig. Nick, follow up?
Yeah, I was wondering, you had mentioned with these shelters for people experiencing homelessness that the filtration systems were good. Were you able to test these filtration systems? How do we know that these filters and places like that at these shelters are good enough to handle having more people go inside and stay inside?
I'll take the first crack at that, and then maybe Leo, Flora, or Jason can follow if I get it inaccurately. So a year ago, we announced a series of things that the city was doing to make sure that we were ready for smoke, and equipped a number of our community centers with appropriate filtration systems so we could bring people inside. One of those is the Rainier Valley, which we indicated is being used as a daycare facility right now. Two of them are the ones being used as homeless shelters. The one we're opening now, the Soto facility, was identified as an isolation and quarantine facility, which for COVID purposes needed to have an adequate filtration and HVAC system. And so we knew it was there ready to go because we've done what we needed to do to keep the numbers lower in this arena. We were able to convert that for these emergency purposes.
Mayor, I can talk from a technical standpoint about the construction. My name is Tony Wright. I'm the Director of Facilities Management Division for King County. And we used very high grades of filtration for the system. And we have operated and tested it when we commissioned it as part of the process to prepare for potential use as a COVID site. We haven't changed anything in the site since then. So we are confident that it continues to operate at that level, and we are checking all systems with my operating engineers as we speak. I'm on site right now. So we're confident this will perform very well and provide a location that reduces most of the particulates. Nothing reduces all, but most of the particulates from anything coming into the system while still keeping it safe for COVID.
Thank you very much. Our next question will come from Erica Barnett, C is for Crank, followed by David Gutman, Seattle Times. Erica, the floor is yours.
Hi, this is a question for possibly the mayor and possibly Dr. Duchin. The rest of us, people with homes are being advised to stay indoors, and obviously we don't have special HVAC systems for the most part. So I'm wondering, for people living outside, why are we not looking to just regular shelters, given that, even though it's not as good as these 5 sites, it's better than nothing. And, are we making the enemy of the good here?
I'll address some of that, and then if Dr. Duchin wants to follow. If I understand the question, first, throughout this process, we've been trying to evaluate the risk of the wildfire smoke against the risk of bringing people into a congregate setting where indoors we know that it is more dangerous for the virus. And unfortunately, almost the same population that is at most risk for the virus is also most vulnerable to the smoke. As you know, Erica, we have around 5,000 people living outdoors in the region. And that there is, given the time period in which we think that this will last, logistically, I'm not sure if you're suggesting that we have a plan to bring 5,000 people in immediately for the next few days. We don't logistically have that ability, but we are trying to reach those people who are most vulnerable and open up this facility that's very large so we can get people particularly vulnerable inside. And we'll be working with the providers to identify those people that we think are most vulnerable.
And this is Jeff Duchin. I would only add that based on the current air quality, we felt that it would be advisable to preferentially bring people indoors or offer them the option to come indoors in shelters that were able to reduce the risk of COVID-19 to the greatest extent possible by having these special air handling features. So if the air quality significantly worsens, then our risk calculation will have to be reassessed. But at this point, and I have to acknowledge, and everyone here I think will agree, there's great uncertainty in this whole business around the precise risk of health effects that a given duration of air quality will pose to an individual and the precise risk of COVID coming indoors. We're trying to balance 2 situations, both of which are fraught with uncertainty. But as the air quality decreases, then the motivation to bring people indoors and the need to do that may increase. However, we feel currently that the most prudent step would be to do so only where we could be assured that we had the best possible air handling to minimize the risk of COVID.
Erica, follow up.
Yeah, why not the Armory building? That's you were mentioning the 5. One is the Armory building at Seattle Center. Why not open that up as a smoke shelter as well?
Jason or Leo, do you want to handle that question?
Happy to. Hi, Jason Johnson with the Human Services Department. We are definitely not limiting our efforts to get people indoors to just this SODO site. We have a program through the YWCA focused on families with young children called Late Night, and they are expanding their efforts to get people hotel vouchers so that they can get individuals who are maybe staying in their cars or living unsheltered with small children indoors. We also have partners at Urban League and Youth Care to make sure that there are spaces for young people. And so we're increasing our capacity to be able to serve those folks and have developed resource materials for our navigation team and our contracted outreach providers to make sure that individuals living unsheltered have access to those resources. At the Armory specifically, at emergency operations call yesterday, where Seattle Center was on the call, they do not have the staffing level to open that facility to a large number of individuals, nor did the provider community have the capacity to help staff that facility. We're incredibly grateful to the Salvation Army for, again, stepping up during this emergency and staffing the site at SODO, but they did not have the capacity to extend that level of staffing to the Armory at this time.
Thank you, Jason. Our next question will come from David Gutman, Seattle Times, followed by Ashley Gross, KNKX. David, the floor is yours.
Hi. Has there been any thought or discussion to advising or ordering businesses that operate with employees outside to shut down? Things like landscaping and construction and outdoor dining establishments. Any thought on advice or orders regarding outdoor businesses?
No, this is Dr. Jeff Duchin. I'll just start and then ask others to comment. But we provide guidance in the public health department to the public, which includes business operators, about the risks and the steps that are needed or should be considered to reduce that risk. We are not ordering people to comply with this personal health reduction, and I'll let others comment on whether they're thinking of such. It's not something I've encountered, but we certainly want people to be aware of the risk. And I think they can use information to make decisions that will improve their health and reduce their risk.
Thank you, Dr. Duchin. David, you will have an opportunity for a follow-up, but just as a quick reminder, please do let us know who you are directing your question to so that we can make sure that we can move more quickly through these Q&A. David, follow-up?
No, nothing here.
Thank you very much. Then our next question will come from Ashley Gross, KNKX, followed by Sydney Brownstone, Seattle Times. Ashley, give me one moment. The floor is yours.
Okay, hi. So first question is for King County Executive Constantine. Is there an end date to having this shelter open, or is it indefinite? And then the second question is for Dr. Duchin, unrelated to the smoke. I'm wondering what advice you're giving to school districts now that the 14-day case average is 65 per 100,000.
So thank you for the question. The shelter will remain open as long as the need persists. In this case, the need is for people, especially those who are most vulnerable to bad air quality, people being able to be off the street. We're going to rely on public health, as we have throughout the COVID crisis, for scientific analysis, for health advice, and base our decision on that expert advice. And I'm sure Dr. Duchin, his previous remarks about not relying on looking at the skies to see if the air is healthy, but relying on experts to help us understand when conditions are improved, I think that advice will apply to your question. So thanks for asking it.
And this is Jeff Duchin following on your question about the schools. So we collaborated with and endorsed the Washington State Department of Health guidance and decision-making tool for when to consider reinstituting in-person learning. And we believe that once the levels are below 75 per 100,000 over a 14-day period, it's time to start considering that. And because of the current calendar situation around the Labor Day holiday, and we've advised the schools to wait 2 weeks to make sure our patterns are stable, because we know that after each of the last two holiday weekends, Memorial Day and the July 4th holiday, we saw spikes in COVID-19 activity and transmission. And it's a lot quicker to go up than it is to come down once you have an increase in transmission. So we believe that we're headed in the right direction. We very much look forward to having our children return to school safely. And we encourage schools to wait two weeks before they bring children back to make sure our downward trend is stable. And also to start with the youngest learners, we need to go slow. We need to be careful. We need to understand that this is an unprecedented situation, and we want to proceed very carefully and cautiously with the youngest learners and those who have the greatest need for in-person presence on the school premises, and then proceed from there. If we can do that safely, then we can bring more children back over time.
Thank you, Dr. Duchin. Ashley, follow up?
I guess I just wanted to clarify. So you're saying wait 14 days after Labor Day, basically before they would phase in possibly bringing in kids for in-person?
Yeah, our guidance was to wait 14 days, or approximately 2 weeks from the time when we passed the 75 per 100,000 mark, which is around Labor Day. Yeah, so that's about right. Yeah.
Thank you, Dr. Duchin. And our final question today will come from Sydney Brownstone, Seattle Times. Sydney, the floor is yours. Sydney, if you are currently speaking, we are not currently hearing.
Can you hear me now?
We can. Go ahead.
So Mayor Durkan, you mentioned that there are more than 3,000 people estimated to be living unsheltered in Seattle and more than 5,000 overall in King County. But my question is, how many additional people does the city and county reasonably expect to shelter from the smoke, given social distancing guidelines in these shelter spaces, some of which are already being utilized?
I'm going to let both Leo and Jason address that. I think the executive gave the amount that the new shelter will allow, but I don't know of the existing shelter capacity. So I'm going to turn it to them.
Thank you, Sydney. This is Leo Flor from King County. We do have space right now for 77 people to come into the Soto shelter. I'm here right now and we're getting that set up, and we'll begin accepting people at 3 o'clock today. We're going to be monitoring really closely how many people are coming and where they're coming from. We have the ability, working with King County Metro, to transport folks from across the county to this facility for its use as a temporary clean air shelter. And if we begin to see that we have more demand for this facility, then we'll be taking a look at additional options, whether it's seeking additional staff on site here or exploring whether there are other facilities. Something that's come up today that really is our critical constraint that I think bears repeating is it's the people who operate and care for folks when we bring them into these shelters that is our critical constraint right now. We have a system that is operating very close to capacity with COVID, as you've already mentioned. And if we can do anything that bring another person inside during this time, we're gonna do what we can to do it. We have performance measurement folks. We have contract monitors in here setting up cots and getting ready to bring folks in right now. And we'll continue to do that if we have to. We're testing the fire systems too.
Thank you, Leo. Sydney, follow up.
Yeah, so again, this question is directed towards Mayor Durkan and Executive Constantine. Because of the pandemic, we've seen shelter throughput slow down as shelters have de-intensified, and simultaneously we've seen encampments become much more visible on local streets, many of which still lack adequate hygiene and sanitation resources. Is the city or county doing anything to expand shelter capacity beyond what was already set up earlier in the summer for people who are currently outside?
Yes.
Adding to that, one of the strategies that we're pushing forward on is building on the success we've had with hotel space, hotels that have fallen on hard times that are available now to house people in individual rooms. And Leo and others, Tony, are helping look at opportunities we might have to bring more people in, either from congregate shelters or in off the streets, and get them into a situation which has proven not just effective in preventing COVID transmission, but in helping people overall to stabilize, to reduce the number of emergency calls, the number of behavioral health challenges, and increase the likelihood people enter treatment or be able to get a job or do the other things they want to do to take back their lives. And I'm excited that we have this opportunity, and that we have learned through the emergency work on COVID that that having something as simple as your own individual room rather than a congregate setting can have such a dramatic impact really across the board in people's lives. And I hope that we are going to be able to quickly build on that realization, on that new reality.
Yeah, and I would add that, again, it's a great partnership between the county and the city that's made that possible, because the county was able to use its resources to pay for the hotel rooms, but the city is supporting all the services that are being provided. And as Leo pointed out before, that getting the space is just one of the first step, but really it's the supported services that make the difference here. And that's the constraint we're facing today, and the part that in the hotels that we do have, for the city and county to be able to partner where we're able to actually get people into those rooms. But the critical component is we also have the service provider there who's able to take care of the people, support their needs, do the case management. And that kind of partnership has worked very well throughout this pandemic, and I think is the exact model that we'll be using going forward. I'd also add that I think that the executive and I are both very optimistic that now that we'll have a regional homeless authority, that we can get that same kind of cooperation, not just between the city of Seattle and the county, but that other cities in the region can step up and find places and resources to actually provide, first, affordable housing for people, but second, for those people that are unhoused, that each city in the county can start giving places where people can be served and have the services they need.